Okay, I guess get started. Good morning. Today is Tuesday, February 18th, 2025. I'm Donna Will, Professional Development Coordinator for the Maryland Department of Health's Maryland Developmental Disabilities Administration. We welcome you to the Coordinators of Community Services meeting. On the panel today we have Nicolette Paparadamas, Director of Coordination of Community Services. Before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. Once the webinar is underway, we will provide access so you can unmute yourselves when you are ready to speak. The microphone icon is located at the bottom of your screen. If you look at the panel interface in the upper far right corner, there are two tabs to notice. The first tab is the settings wheel, where you can select computer or phone. The second tab moving to the left is the question box. You can enter questions there. The third tab moving left is the paperclip icon, which represents the materials. We have one PowerPoint loaded for you today with the February 18th presentation. If you are listening by phone, you can request that it be emailed. If you email me, Donna Will, that's donna.will@maryland.gov, I can email you the presentation. We will be recording the webinar and posting the session on YouTube and the DDA website. So now I'd like to introduce Nicolette. Good morning, Nicolette.
Good morning. Hi, everybody. I hope you're well. I understand that there were some current concerns about the webinar not being on your calendars. I wanted to let you know that when you sign up for GoToWebinar, the confirmation email will have the option for you to independently add it to your calendar according to your email account. So there's, Google email, Microsoft, the Apple options. So please know you will have to add this, but it is the third Tuesday of every month. So you could also feel free to put a placeholder for these meetings. So without further ado, today, thanks for joining us. We're going to be reviewing the process of what to do when someone needs to reapply for a waiver, how to correctly enter the level of care effective date into LTSS Maryland, what to include in person-centered plans, and monitoring and follow-up forms. We're going to provide policy and program updates, including the new online form for appeals, and address frequently asked questions that we've been receiving across the state. And lastly, we're going to review available resources listed on the DDA website that can support people with daily life and employment. We'll address questions at the end of the presentation as to ensure that everybody receives all of the important information before we dive into specific inquiries. And feel free to enter your questions into the chat box so you don't forget them. We appreciate your patience and we'll attempt to address all questions thoroughly before we conclude the meeting. Next slide, please. We'll be discussing our statewide themes and trends first. And we will begin, next slide, with Amma to discuss Medicaid waiver eligibility. Next slide, please. Thank you.
Good morning, everyone, and happy Tuesday. We have seen applications submitted without waive placements. Individuals who are denied enrollment or are disenrolled from any of the DDA-operated Medicaid waiver programs must be added to an LTSS waive before reapplying. A new waiver application cannot be submitted by a coordinator of community services for the individual unless they have been added to an LTSS waive. CCSs should reach out to the regional office if an individual wants to reapply or an individual has been globally deactivated and wants to be reactivated. Next slide, please. Nicolette.
Thank you. So DGA and Liberty has recognized CCS is submitting level of care forms dated prior to 2022. Any forms other than the current and authorized level of care form, which is posted on the DDA CCS website, will not count towards compliance. So please ensure the correct form is utilized and uploaded into LTSS Maryland. And here we posted the links for you, and also the PowerPoint slides are in our uploaded webinar for you as well. So wanted to let you know that. Next slide, please.
Thank you, Nicolette. Prior to entering a DDA-operated waiver program, an individual must be certified as being in need of waiver services and must meet Maryland's developmental disability eligibility criteria. Their certification of the level of care form serves as documentation that an individual is medically eligible to participate in the DDA-operated waiver program. Pages 59 and 68 of the DDA waiver includes details regarding the level of care. As part of the concurrent eligibility process, the CCS should complete the initial level of care form when they meet the family to complete the Medicaid waiver application. The level of care effective date should then match the Medicaid waiver application signature date. Make sure that all forms are signed and dated. The date of the Medicaid application is signed, the date the Medicaid application is signed should be the same date listed on the initial level of care per the concurrent eligibility process. Next slide, please. Okay. So here we have an example of the MA application signature page and the level of care form within LTSS Maryland. The level of care effective date should reflect the same date as the date the MA waiver application was signed by the applicant, as shown in the picture. Next slide, please. The level of care end date should reflect the year after the initial level of care effective date. And next slide, please. Turn this over to Debbie.
Hi, just wanted to check in. My computer's not doing fantastic, so hopefully you guys can hear me okay. I just wanted to review some tips on person-centered planning. Truly what we need to see based on some of the challenges that we're seeing throughout the state is that the CCS open the person-centered plan at that 90-day mark and enter the meeting date as soon as possible. That way supervisors can start tracking the plan development to make sure that we're on the right time frame to get it submitted within that 20-day time frame. Another issue that would help tremendously in both the CCS documenting what happened in the PCP, as well as if regional office or headquarters staff need to check in or determine what's going on with the PCP, is writing those comprehensive meeting minutes. Please make sure that your CCS include all of the attendees. A lot of times we're reviewing notes, etc., and they'll mention Nicolette or they'll mention Alma, but they really don't discuss their role and how they're connected to the individual. So those comprehensive meeting minutes are a good tool to allow us to go back and see who the primary contacts are, as well as we know that multiple times you're having problems with provider agencies. For us to be able to see who from the provider represented them and committed to the outcomes, goals, and services really helps when we're trying to advocate on your behalf regarding plans. I think that's all.
Thanks, Debbie. Next slide, please.
My apologies. One more thing I forgot. A great way to track it, and I just looked back over, is for the supervisors to use the all person centered plan report because it shows the create, the meeting, the progress, etc. So that is a great tool.
Thank you. Alrighty, so we have recognized an increase in auto extend plans. There are, I'm sure, many barriers as to why this is occurring. One, we wanted to ensure that CCSs are working with their supervisors, right, regarding any challenges in submissions, and that those barriers should be reported to the regional office for any technical assistance needed prior to the 20-day submission, right, to ensure timely review and approval. Any plans in an auto extend should have their annual plans prioritized and submitted, including those that are in clarification. We shouldn't leave plans in clarification for more than 5 days, and if you're faced with any barriers, communicate those with the regional office. Utilize the LTSS Maryland reports to identify a list of your agency's current active auto extend plans. Next slide, please. Now we're going to be talking about virtual supports. We recognize that virtual supports is being provided, but it's not clearly documented within a participant's PCP. So we wanted to remind that if a person is receiving virtual supports, that you're and it's identified in the service service implementation plan. So the virtual supports has to be identified within the service implementation plan, and it has to be agreed upon by the participant to support them to achieve their goals and needs. So it must be reflected also within the person-centered plan. So we want it in the SIP, the service implementation plan, and documented in the person-centered plan. Next slide, please. And as you know, during monitoring and follow-up, CCSs should ensure the services outlined in the person-centered plan are being provided accordingly and the person's meeting their goals. So when someone's receiving virtual supports, the CCS should inquire with the participant and their team on the quality and the effectiveness of virtual supports as it's outlined in the PCP. So how is it being rendered? Is it meeting their needs? Are they making progress towards the identified outcomes? And if they're not, what does the team suggest? Does the person-centered plan and service need to be revised to better support the person in the meeting their outcome? This should be recorded in the monitoring and follow-up form when applicable. And we're talking here also specifically to virtual support. So we want to be specific and outline that. The team must discuss an action plan, right, if the virtual support is not meeting the person's goals to support them. To better support them in achieving and meeting those identified needs and goals. Next slide, please. So we've mentioned in previous meetings that the CCS should plan ahead, schedule their monitoring, their in-person monitoring visit, and there are instances of participants unable to be contacted or their visits are canceled, right? So again, we've recommended schedule ahead of time at the beginning of the cycle, the quarterly visit. We've also received inquiries of the time frame if that a visit can occur. So generally speaking, outside of the quarterly, we've received inquiries if this could be done for any of the required frequencies, annuals, monthlies, and so forth. So to address it, we want to remind you that an in-person visit can occur anytime up until the due date. The form must be completed and submitted by the due date. So the date of the visit must be within the time the form is generated up until the due date. When a form passes the due date and the CCS has opened the monitoring and follow-up form, it will enter the status of overdue in progress. And this period of time provides the CCS time to enter the details of their monitoring and remediation strategies onto the required form for 15 days. So the overdue in progress is available for 15 days to allow the CCS to finalize the form. Next slide, please. So in this example, the CCS service type is community coordination. The person's receiving DDA services. For example, they have a person-centered plan and are receiving personal supports. So remember that the due dates are determined by the person's annual plan date, and the required frequency of in-person visits is quarterly. The previous due date was 6/1/2023, as we see in the image. The new form's due date is 9/1/2023. So the in-person visit can occur anytime between 6/2/2023 through 9/1/2023. Next slide, please. We've recognized that the recommended action section of the monitoring and follow-up form doesn't include detailed information on how the CCS follows up and ensures identified concerns and how they're addressed. Specifically, at the bottom of the monitoring and follow-up form exists the recommended action section. The CCS uses the consideration and confirmation sources within the monitoring and follow-up guidance to assess participant satisfaction, ensure services align with the person-centered plan, addresses health and safety, and identifies changes in need. These findings are documented in the monitoring and follow-up form, included how they were determined. If concerns arise, the CCS collaborates with the team to develop action steps, which are recorded in the recommended action section of the monitoring and follow-up form. The CCS must ensure these actions are completed. The CCS can update the form at any time to edit or close out the completed actions. So in this example, the action is that a nutritionist would plan meals and have a daily exercise plan. So following up looks like the nutritionist was identified. There is a daily exercise plan, and it's included in the person-centered plan. Or if something else occurred, that's identified in the monitoring and follow-up form accordingly. Next slide, please. So in this example, the CCS checked the electronic visit verification, EVV, and found that the hours of service are not being utilized according to the PCP, right, the person-centered plan. So to understand, the CCS is asking the person, the family, provide the reason that they may not be utilizing the services accordingly, right? Was it the participant's choice? Was the person unwell? Are they making progress on their goals? What did it look like when the person wasn't receiving services as defined in their SIP, their service implementation plan? Were there any health and safety concerns while the services were not provided? Were any other concerns reported to the provider? So action steps, after understanding everything, the action steps would be what can be taken, right? If there were health and safety concerns, the CCS should immediately report any incidents according to the PORI guidelines. It would be noted in the recommended action section, and they could also schedule a team meeting to discuss how they will address the areas where the person was not meeting their goals and needs. Do they need a new schedule developed? Does the person want a new provider? Do the hours need to be reduced as they're no longer needed? Are there other natural community state resources that a CCS can recommend? The PCP will need to be revised accordingly, and these actions would be documented within the monitoring and follow-up form. And of course, at the end, we want to close the loop, right? The CCS should check, were these identified action steps taken? Did the CCS follow up with the person afterwards to ensure that they are now receiving the adequate supports? Did we revise the PCP? So just, of course, review your monitoring and follow-up form and follow up with the person and close that loop. Next slide, please. Now we'll be talking about policy and program updates, and specifically about the appeals process. Anyone applying for or enrolled in Medicaid who thinks the decision to deny, suspend, and reduce their Medicaid eligibility or services is wrong has the right to ask for a fair hearing about that decision. A fair hearing is also known as an appeal. An appeal can be requested for denials, including person-centered plans, developmental disabilities eligibility, and Medicaid eligibility. So in addition to submitting requests via post mail or fax, this online form was created and released December 15th. The best way to submit your request is to use the online form. There is a full website form and one that can be completed on a mobile device. This page includes frequently asked questions, contact information, mailing address, fax numbers. And when you complete the online form, you also receive a receipt via email if you choose to. Oh, I'm sorry. The next slide, please. Apologies, everybody. So this is the appeals in which I was just discussing. The link is there for the full access, and the mobile access is there as well. And again, just to reiterate, there is a frequently asked questions form there. If you have any questions or concerns that you want to look through, there's contact information for follow-up and mailing address and fax numbers if needed. Please take a look at the form. It's user-friendly. And again, you do receive a receipt after completion. Next slide, please. So, excuse me, we understand that eligibility, EDD has been very challenging for quite some time. And frustrations are increasing, and CCSs are being encouraged to email legislators, the secretary, deputy secretary of the state, to express constituent inquiries and concerns. So we really want to, let you know that it's important that CCSs follow the guidelines that the DDA has provided them. And remember that CCSs are agents of DDA, which means you're an agent of the Maryland Department of Health. CCSs are to work with EDD caseworkers and their supervisors to address challenges and concerns. The regional office eligibility and waiver team members are also available. And the CCSs can inform people and their families of their options to express dissatisfaction, but it's important that CCSs should not be completing it on their behalf. Okay, next slide, please. And now we will be welcoming Mary Ann, our Director of Family Services and Supports, to go over some resources and other related activities.
Good morning, Nicolette. Thank you. Good morning, everyone. Yes, as coordinators of community services work with individuals and families, DDA wants you to know that we do in fact provide a comprehensive list, although not an exhaustive list, of key statewide resources, supports, and services on our website, which are available to children and adults and families in order for them to live their best lives. These resources are designed to assist them in all the various ways. Today, when you go to the site, you'll see that the supports and services are listed. The supports and services listed are offered through government agencies, nonprofits, and private organizations that serve the entire state. They are organized according to Charting the Life course, life domains, which include daily life and employment, community living, safety and security, healthy living, social and spirituality, and advocacy and community engagement. This morning, we will focus on daily life and employment. Within this category, you'll find resources tailored for children, adults, aging individuals and families. The types of resources you'll find include services such as Locate Childcare, food and cash assistance programs, Maryland Able, education and technology supports, and employment resources like the Association of People Supporting Employment, as well as the Department of Aging. In fact, did you know that the Department of Aging, through their area agencies on aging, provides funding for respite to grandparents and other relatives, not parents, 55 years of age and older, providing care to children under the age of 18, and grandparents and other relatives, again, not parents, 55 years of age and older, providing care to adults age 18 to 59 with disabilities. Are you supporting a child or an adult being cared for by a grandparent in need of respite? This may be a resource for them. Finally, all of these resources provide various supports to ensure that children, adults, and the aging with IDD and their families to live, love, learn, work, play, and belong in their communities, regardless of their life stage. We hope you'll use these. Check out the website, and hopefully you'll find some things that you weren't already aware of. Alrighty, that's it. Thank you. Next slide, please.
Thank you, Marianne. Really appreciate that. And I wanted to let everybody know that Marianne has developed that website, and it is available to anybody to utilize. So at each month, she's going to be going over each section. It is developed in the framework of Charting the Life Course framework, which again, I mentioned at the last meeting, would also align with the person-centered plan. So if there are resources and related activities that you are recommending and seeking out or utilizing to support the participant, those could be added under those sections. Okay. All right. So for your convenience, these meetings are posted. We post them on the DDA YouTube channel and the DDA website, partnering with CCSs. The Partnering with CCS website also includes the PowerPoint slide deck. We will be also posting meeting minutes as well. Right now we have the YouTube webinar and the PowerPoint slide deck PDF. So if you ever need to refer to it, they are placed in two places online. Next slide, please. All right. And again, as you know, if you ever have any agenda topics, questions, details about presenting for your agency's accomplishments, please send those to me. Again, we do want to hear from all of you, any achievements you've made within your agency that will help support other agencies. You know, we want this to be collaborative, and we want you to also present and speak and share strategies that have proven effective within your agency to support people, your compliance measures, performance rather, right, in all regards. So even success stories. So anything that you would like to share that you think would be helpful for your colleagues here. You know, we're all in this together. So please reach out and we'll have a conversation and meeting to discuss it. Next slide, please. Now it's time for questions. And we
Nicolette,
have oh, go ahead.
sorry. I was going to say a few questions have gotten some written answers to them. Would you still like me to read those so everyone can hear them, or should I skip over those?
No, go ahead. You could, read those so everybody can
Okay.
hear it.
Well, first off, happy birthday. Somebody wished you a happy birthday in the chat.
Thank you. Thank you, everybody.
The first question is, when a CCS requests that a person be added to a wave, how long should we expect to wait before receiving a response?
I will defer that one to Ama, or any of the regional offices if you have a response time for that.
I have that. So we do process these requests as they come in. We do have to take several factors into consideration. Once a request has been submitted and the necessary criteria is met, we do make a determination right away and add individuals to a waive as soon as those criteria are met.
Thanks, Ama.
The next question is, when did DDA restart asking for CCS to complete PCP meeting minutes?
I think that they've always been strongly encouraged. I think that, if you've been around for a long time, you know that they were required as part of the waiver application, as well as they are just a great source with Liberty Healthcare coming in and reviewing notes. It just makes sense that if you have comprehensive um, meeting minutes, that it will allow for your other notes to make better sense. And, just the basic tip that if they can find everything, if the reviewer or licensing or whoever can find everything in one comprehensive note, they don't keep digging.
And the next question is, who is responsible for reviewing the EVV report? Is it the CCS? If so, where is this report located?
Yeah, so in the PC monitoring and follow-up guidance that was published, June or July of last year, under the confirmation and consideration and confirmation sources, excuse me. There is a section, and then also in, there's another document, but anywho, the EVV report is in LTSS Maryland reports. It is there to support you in seeing the utilization of hours. Accordingly. Yeah, sorry, I'm thinking at the same time, you guys know me, but I am happy to go over that with you one-on-one or at one of these meetings if needed, just to show and reflect what that looks like. It might be a little hard in this meeting, so because of public health information, personal health information. So let's connect, and I'm happy to review that with you.
Next question is, can you go into a little more detail about the appeal form, who has access and should complete it?
Yeah, sure, and I'll read it. So I said, great question, Rosemary, because it is. It's a public form. It's posted online for anybody. I recommend that CCSs support participants by explaining their rights to appeal, right, as we have been doing so, and inform them of their options of how to appeal. So in the letter, it'll give the email, the fax, the post mail address, but we also have this online link now. So the online link does provide a confirmation receipt, which is great. And because it's a new online form, I believe that it is a more of an efficient and processing for an appeal, an efficient measure to process, right? Online technology. So.
The next one, the first part, has already been answered, but I'll read it anyways. Has a response time frame been established for waiver slot decisions / waive placement requests? And the second part is, how are pending packets being processed that were submitted prior to the December 16th change?
We are, again, processing them as they come through. We are working on compiling the list of packets that were submitted prior to the December 16th notification that we sent over. We're working with the regional offices to make sure that we're capturing all of those. If there's any additional information, we can provide that on our next call.
If someone's EDD case manager in LTSS is Tion Blake, who should we contact? We were informed that he no longer is with EDD.
In instances where the caseworker no longer works there, you can always reach out to the supervisor. Carolyn Cornish is the supervisor for Community Pathways Waiver, and Patrice Miller is the supervisor for Family Supports and Community Supports Waiver. I will put the dedicated email address in the chat so that everyone has access to that. You can also reach them through that.
Is there a timeline for waiver approvals for crisis resolution cases?
Once a person has been deemed crisis, we put the person on a wave within 48 hours. And it's our expectation that we follow the concurrent eligibility process in submitting all those documents. Our partners at EDD are processing these documents as they come through. Some of the things that we've heard is that there are instances where they're not receiving all the documentations that are needed in order to make a determination. So as part of supporting the individual in crisis, we request that all supporting documentation is submitted with the application to allow fast processing, more or less.
Is a monitoring form that is submitted but pending recommendations considered submitted?
I'm sorry, can you say that question one more time?
Is a monitoring form that is submitted but pending recommended actions considered submitted?
It is submitted. Pending recommended action says that there is follow-up that's needed. So that follow-up should be followed up and completed. Yeah.
Can anyone on the team complete the appeal form?
I would look at the frequently asked questions on that page. Remember, appealing could go to a hearing. So whoever is completing that form should understand that. But I would definitely visit the website, the frequently asked questions document. But again, remember, it is a form to request an appeal, a legal appeal.
Then we had two that came in back to back that both say what were the December 16th changes that were mentioned.
On December 16th, DDA sent out communication to all CCSs, notifying them that an individual must be added to an LTSS waive prior to submitting a waiver application for them. So that is what we're referring to when we talk about the December 16th change. It's not really a change, but it's more of a re-emphasizing a rule that already existed.
That's it for the moment, unless any last minute questions come in.
Thank you. Thank you. Appreciate that. And then if anybody wants to unmute themselves, please feel free and ask some questions. To ask any questions, I want to thank all of you. I want to thank my team here for presenting today, and we hope that these meetings are useful. If you have any recommendations, please send those my way as well. And again, we want to hear from you. I'm going to start reaching out to some of you to see if you're interested in presenting. Alrighty, well, that will conclude. We might have met record time today, but thank you all for attending. Again, this will be posted on the DDA CCS Partnering website and the YouTube channel. So thank you so much, everybody. I hope you take care and have a lovely rest of the day and week. Bye-bye.